Hi, I'm Dr. Partha Nandi from AskDrParthaNandi. We all get the winter blues when we feel there's a day or two when we're down and I don't want to do anything. But what happens when those days become weeks and months? Could we be dealing with something more serious? Could this be seasonal affective disorder? So people ask me, Dr. Nandi, what is seasonal affective disorder? It's a type of depression where you have these feelings. People get them a lot during the winter and late fall. And what happens is you lose energy, you lose the interest in doing things. Stuff that's usually fun becomes work. And so these symptoms, when they last for more than a couple of days, you may be dealing with seasonal affective disorder. So what exactly is it and what causes it? We don't know what causes it, but we think it may be due to your body's rhythm. Your body's rhythm may be altered because there's really not as much light in the wintertime. Also, certain chemicals, for example, serotonin and melatonin, may not be available like they are normally. And so those factors may make it so that your body doesn't have the energy and what it needs to do its activity. So when should you see a doctor? When does it become serious enough that you should see a health professional? I believe when it starts interfering with your activities at work, at school, when fun becomes work, when your appetite changes or you have changes in sleep. And finally, if you have any problems with thoughts of suicide, immediately get to a doctor. So when you get to a doctor, what can they do? Well, we have a lot of treatment options for this disorder, so we can really get a lot of help pretty quickly. First of all, you can get light therapy. You sit a few feet away from a light box. Sounds pretty easy, but it really can affect you. You can also get medications, and I'm all for medications, in the right setting. But I think if you can get psychotherapy, where you talk to a psychologist or psychologist or psychiatrist, that can really help you get coping mechanisms to deal with these problems. And then finally, you should get out. What happens is that when you get these types of disorders, you know what I'm talking about, it's crippling. You want to stay inside, you want to be cooped up. Rather, studies have shown that if you get out there, exercise, and really make more of your life and become more active, it helps. Even if you're inside, make your environment more sunny. These simple tips really help you to become your own health hero, where you can advocate for your health. Remember, seasonal affective disorder is a real